Hey, hope things are going well there. It's Dr. Matt here. I want to touch base with you with some things that you can do to help with SI joint discomfort. Okay, so we see many people in the office that have challenges, whether it's SI joint dysfunction, whatever you may have reached a limit, right? And whether your low back's bothering you, it's your SI joint. I'm going to share you some things that you may find really beneficial today, and some things that I've shared with patients in the past. Now, keep in mind, there's a couple things often happening. Right? If we've reached our limit, a lot of times there's been some level of dysfunction for a period of time before the alarm bells started going off, and maybe you're getting some discomfort. So what I want to share with you today is some ideas, some things to consider, and then go from there. So a lot of times we were just actually having a conversation that the two are connected in terms of social factors, your environment, and also the physical part. And what I like to think about is how you manage your state. Right? And whether you feel it or not, you have to manage your stress response for proper healing. Now, a lot of times we'll look at your SI joint. I'll bring you down a little bit just so you can see. But your SI joint through here, maybe there's been some chronic challenges that have built up over years. And now keep in mind, many times it's the 998, 999 for the 1000th thing just pushes you over the edge, and it's a cumulative effect over time that has created the challenge. So it's going to take some process, some time to help build you back up. And what I was saying is that, especially as a family corrective chiropractor, I want to know if you're shifted and stuck, right? And also if the nerves are irritated, not just through here where you may be feeling the alarm bells, if you will, but also up through here, because all this information has to travel all the way down, and the messages have to get in and out to your muscles, your organs, so that your body can work at its best. And that's part of the reason why I check and adjust you for nerve irritation to help your spine and your nervous system function better. But I was also mentioning the stress part, right? And the neat part is corrective chiropractic care may have an impact on your stress response, which if you're in the stressed state, you're not typically going to work as well. So you have to get to the healing calm side of your nervous system to help your body relax, see better opportunities to look after yourself, and heal better. Okay, so chiropractic may play a role in helping you change your state too, which is really neat. And you see it all the time, from clinical practice, patients improving their life and saying, hey, I'm more relaxed, I see more opportunities to look after myself better now, which is really cool. So what can you do at home, right? We got your SI joint, right? Some of the basics. I'm going to actually lay on my back right here, right? And when I lay on my back, I want to show you just some of the neat things, just like this. If I were to lay on my back, let's say my right SI joint was bugging me, I would work on both sides, but maybe if it's my right side, I'm going to start on my right. So I'm going to lay back, and before you even get out of bed in the morning, what you can do is just gently bring yourself up just like this. And now hold yourself up there, and you're thinking about opening yourself up, stretching your glutes, breathing, right? And I'll hang out here. You may hang out, I'd like to see like a 1 minute to 2 minutes breathing, right? And now, one of the neat things I want to show you is, if you're going to stretch your left side, right, actually let your right side fall off. So you're going to open your hip flexors up here. And you can do it with both sides. This is a modified version. But again, you're going to hang out for 1 to 2 minutes. And this one, you'd be stretching your left side and opening up your right side. And just hanging out and breathing for 1 to 2 minutes. A lot of times, people find that effective just in terms of loosening up their glutes, but also opening up their hips. If you've been sitting all day, it's important to open them up. So this is something you can start your morning off with. And then what you can do is bring yourself up so you can even get a little bit more extreme, if you will, with that glute. And what you can do is bring yourself up and actually be nice and tall, but lean over like this. And I'll breathe in, hang out, and again, 1 to 2 minutes on each side. And I'll even put some pressure down here on my knee and bring my ankle towards the sky. So you have two variations of opening up the hips and the glutes, and a lot of times really beneficial in terms of helping just the muscles around that SI joint and around the hip, loosen up, and you're just being proactive in terms of looking after yourself as well. So consider those two things. I would, without a doubt, work on some strengthening too, right? In terms of making that SI joint more resilient, so you're less likely to break down in the future. And one of the ways we do that, we've talked about the bird dog before, which I think is, phenomenal exercise just in terms of spinal hygiene. But what I would do is actually just lay on my back and gently lift my buttocks in the air, and I'll show you. So I've taught you 2 ways to stretch and mobilize. Now what you do is just do one of these, and what you can do is lift up, pause, and back down. Lift up, pause, and back down. So with this, I would work in the range of, I'd work in the range of 10 to 15 reps. Okay? So consider all those things. And remember, when you're doing something like this, and you're working on your own health, and something natural health, strength training, nervous system, spinal checkups, right? Consistency is the last one, builds on the next one like a new lesson, right? Especially if you're trying to retrain your spine, your nervous system, and you're doing some of the mobility work on your own at home. Consistency is key to help getting you a result, okay? You increase the likelihood if you're consistent. Otherwise, thank you so much for tuning in, and I appreciate you. I know I mentioned before, I got a big mission in terms of helping people understand they got to help their bodies function better to be healthier. Much of what you do throughout your day helps with that. The spine and the nervous system, corrective chiropractic care, and the health of the spine is raising that awareness, a big part of my mission. So if you found this useful, I can't do it alone. So if you found it useful, please take a moment to click share. I would love it if you could, and just share the message with other people who may see the benefit as well, and being proactive with their health and getting back on track. So thank you very much. I appreciate you, and I will talk to you soon. Bye for now.